So just want to start by saying how exciting it is to have everybody here together in the room. And huge thanks to Mass LBP and the partnership we've had with them to make this day happen. Peter and I co-conceived this idea, I think, almost 2 years ago, and it's really, really exciting and actually a bit emotional to kind of see this come into play today, to have you all here. So thank you. I'm excited today to tell you about the results of the OurCare survey, which I think all of you or most of you have taken. And I hope, we'll talk about some of the key highlights. There's a lot in here. We can certainly pause or go back. But I hope that it's something that will inform, I guess, your recommendations, because the way I see it is we have basically this survey to take the pulse of what it is that a broad swath of people in Canada want to see. One thing, so I'll just say off the top, we heard from about over 9,000 people across Canada in this survey. There were 2 ways people could answer. Part of it was sent out through our partner Vox Pop Labs and proprietary panel that they've developed over time through many of their platforms. The other way was just a general link. And we tried to work with some community organizations as well to have them support people to actually go through the survey. Off the top, I'll say, though, that just the process of the survey itself, of course, there's some limitations because it was in English and French. It was about 15 minutes long. It was pretty complex in some ways. And so it genuinely limited to some degree who it is that would be able to reflect. And we can see in the results of the survey, too, that there's some groups that were less represented. So we were less likely to hear from people who were racialized or who were Indigenous or who are new to Canada. So it's important to remember that some of those perspectives are not there, but I still think it provides a really interesting snapshot. So I'm gonna just go forward here to talk about, so as I said, one thing that I wanted to mention is one thing that we did when we were analyzing the results is that we really only took completed surveys. And the reason for that is we needed people to get all the way to the end to answer the demographic questions. So those are the questions like your age, your gender, whether you were born in Canada or not, your race. And based on people's responses to those questions, we actually weighted how much any survey response was valued in the analysis, if that makes sense, to try and have it be so that our general survey results more broadly reflect the demographics of Canada. So we used a few different variables on that. So gender, age, education, income, language, and region. We looked to see kind of what's the broad swath of Canada like in these 6 categories, and what was our survey respondents like, and we tried to match up our survey respondents. So if there, for example, were more women who responded to our survey, everybody's opinion was counted, but any single woman's survey might have been counted less because there were just more women proportionately who responded to the survey. So I hope I'm explaining that okay, but all this to say is what I'm going to present right now are weighted responses. And if you haven't done so already, I definitely recommend exploring the data on data.ourcare.ca. And a huge shout out to our partner, Public Square, who helped us to develop this site. And I also want to actually shout out to Miriam Dinesh at the back, who did a lot of work to help us with analyzing the survey. So to start off, I think the main finding today, now it's so much better. Projection, speaking loudly, that's not my forte here. So the main finding of the survey was that 22% of people who responded did not have a family doctor or NP they could see regularly for care. So translated to the full population of Canada, that would mean 6.5 million people 18 and over without a family doctor or NP. This is pretty staggering. It's a staggering number to begin with, but if we think back to 2019, pre-pandemic, it was Statistics Canada estimated at that time 4.5 million people 12 and over. So this is a much higher estimate, and it actually is in line with some other surveys that have been done since then, although our survey was much bigger than the other surveys that have been done since. Importantly to note that it wasn't the same for everyone. Some of the biggest differences actually were by region. So actually in Ontario, we're faring better here. So I think there were only about 13% who were without a family doctor or NP in Ontario, compared to Quebec and the Atlantic provinces, where it was over 30%, and BC, where it was 27%. So some of the biggest differences were regional. Another big difference actually was by age. And here I think, though, we need to pause and think about it, because it's true that if you were younger, you were less likely to have a family doctor. But at the same time, we know that many people who are young don't necessarily want a doctor, they're healthy. There were about 13% who were 65 and over who said that they didn't have a family doctor or NP. But to me, that 13% is pretty significant, because everyone pretty much 65 and over needs to have a family doctor or NP. So we have to take some caution how we interpret this. So some other differences, we saw that, some differences with people living with a low income. They were more likely to report not having a family doctor. People who were racialized, people who were men or actually a gender other than man or woman, they were also more likely to report not having a family doctor. So out of the people who had a family doctor or NP, 95% said that it was a family doctor, and 5% said it was a nurse practitioner. And then we asked a number of questions of the people who actually have a family doctor. And so some of the things relate to, whether people are really able to get timely care. So this question asks, is your provider or someone in their practice available to help with urgent issues at the following times? And what we can see is that, there are about 37% of respondents said that actually their provider wasn't able to help them, or someone in the practice wasn't able to help them outside of 9 to 5, Monday to Friday. Another 27% said they didn't know. So important kind of finding in terms of people's ability to be able to access care outside 9 to 5. Then we did ask, did you have an urgent need over the last 12 months? And if so, then we asked, how long did it take you to, when was it that you were able to get the appointment that you needed? How long did it take from when you first tried to book the appointment to when you actually got it? And what we saw is that about 35% said that they could get a same or next day appointment. About 50% said it was, within 3 days. But these were all people who had urgent needs. And, many of them were, you could see, waiting more than 3 days. And some, even it was, never able to get an appointment 1 month or more, or 2 weeks or more, 1 to 2 weeks. So anything over here was more than 1 week, which is really, I think, not great, pretty unacceptable, I think, for urgent appointment. We then asked the people who didn't have a family doctor or NP what they were doing. So we first asked them, do you have a regular provider that you could see that's not a family doctor or NP? And about 12% said they did. And out of the 12%, this is sort of what they said that other provider was. Most of the time it was a specialist, sometimes it was a pharmacist, and then there were a variety of other answers. Where were they getting care when they had a problem that was not urgent but still needed attention? Most ended up going to a walk-in clinic. The second most common was a virtual. So first was an in-person walk-in clinic. The second most common, a virtual walk-in clinic, and the third, a hospital emergency room. We did ask, when you had to use that option, then did you have to pay a fee? And actually about 1 in 5 people who used one of those options ended up having to pay a fee for something. And I think this is interesting. And I should say, we don't have a slide on this here, but then we asked, what was the fee? Oh, no, this is the slide. What was the fee for? And you can see here that about 80% of the time, it was actually for the appointment itself. So a lot of people who don't have a family doctor are seeking care in walk-in clinics or emergency departments, and often having to pay a fee even for the appointment itself, which is, really troubling to me personally. So then we asked, are you trying to find a doctor? And we asked this of everybody. So whether or not they had a family doctor, we asked, are you trying to find a family doctor? And what we found is about 30% of people, of the people who were trying to find a family doctor, so quite a few were, and of the people who were, 30% were trying to find a doctor had been looking for less than 2 years. And you can see, I guess, overall, It was about, of the people, about 30% said that they were trying to find a family doctor, and about 30% of those had been trying to find one for about the last 2 years. Interestingly, some people who didn't have a family doctor were not looking for one, and we asked why. So about 1 in 5 people who didn't have a family doctor weren't looking for one, and there were a variety of reasons. So some people said, I'm healthy and I don't need one. I'm happy to get care from walk-in clinics, but some people had also just given up. And then there were some people who had a family doctor who were looking for one, and so they ranged everything from like, I recently moved, so presumably their current family doctor was far away, or I'm not happy with the provider I currently have. So there's people who currently have a family doctor who are trying to move out as well and find a different one. I think one of the most interesting sections is this next one, which is what is important to people. So probably not a surprise, but we asked people, how important is it that every person living in Canada has a relationship with a family doctor, NP, or team of health professionals that they can see regularly if they need to? And 97% said it was fairly or very important. We then asked a series of questions that related to this one, where we said, when you think about getting care from a family doctor or NP in the practice they work in, how important are each of the following to you? And the top 5 responses that people ranked as very important, I've listed here. The very top one was that they wanted their doctor or NP to know them as a person and consider all the factors that affect my health. The second was that they stood up for them, so that they stand up for me. The third was that they coordinated the care that they got from multiple places. It was only actually the fourth one that related to timeliness, that if they had an urgent issue, they would be able to see someone and get advice within 24 hours. And the fifth was that they could help meet my health goals. But I think this is one of the most interesting findings for me from the survey, because it really puts forward what are the most important kind of values and priorities from the people who answered. And to me, it really stresses that most people here are looking for a relationship with someone that they know, who knows them, who can take that relationship into account when they're providing the care. We also asked how important it was for people, for their family doctor, NP, or team, to work close to their home. And 88% said it was fairly or very important to them. So we then asked a whole series of questions about walk-in clinics, and I'm not going to go into a lot of detail here about all of that. So there's more detail on the website, but just to say that people are using walk-in clinics. About half of the respondents had used one in the last year, and sometimes there's a variety of reasons why. But one of the more interesting areas, and I think this is food for thought in advance of tomorrow, is we asked a whole bunch of questions about new virtual services. So we asked a question, we talked about new virtual services being, these services where you can quickly get in touch with a doctor over the phone or by video or online chat, but they're often very convenient, but often that virtual service doesn't have access to your records, they're not going to see you again, and they often don't have a place where they could see you in person afterwards. And so then we asked them how willing they would be to use such a service and then we listed out a few things that we know actually exist. And so we asked, how willing would you be to use it if the service was owned by a for-profit company? And 58% said they were not willing. We asked, how about if it was received payments from or was owned by a pharmaceutical company? And 70% said not willing. We asked, how about if it charged them for things you could get for free if being seen by your regular doctor or NP? And 78% said they were not willing. And then we asked them, how about if they sold your data to a pharmaceutical or insurance company after removing information that could identify you? And 84% said they were not willing. So what's interesting to me about this is a couple of things. So one is when we look back at that survey, remember I said, where are people who don't have a family doctor getting services? Well, the second most common place were these virtual walk-in clinics. So people are using them, but at the same time, they don't really match up with their values of like what it is that they want, because probably they may not have great choices, but we can also surmise or hypothesize, I should say, that maybe it is that they don't actually know that these things are happening behind the scenes. So some really interesting food for thought here that I hope you guys will explore a little bit more tomorrow evening. So then we asked a whole bunch of questions about, virtual care more broadly, and how would you like to get care from your family doctor and NP? And I think to me what stands out here is, of course, the number one priority for getting care is in-person scheduled appointments. That's what everybody wants. 66% said they did want phone. 54% said they'd actually like in-person drop-in visits. And then it goes quite a bit further down there when you talk about video or communication by secure messaging. People want it, but it's not as important as those other dimensions. We then had a few questions about teams. So I think we've heard a lot about team-based models in Ontario. And so just to remember, this was a national survey, and when we asked people about teams, it was interesting that most people's family doctor or NP did not work with other health professionals. So you can see that only 30% said they had a nurse in their practice, 10% had a social worker, 13% had a pharmacist or dietitian. So very few people responding to the survey nationally were reporting team-based care in their existing practice. But when we asked them, how comfortable would you be getting support from another member of the team if your family doctor or NP recommended it, 90% said they would be comfortable or very comfortable. And then we asked, which team members would you think are most important? And here, they talk about nurse practitioners, the nurses and pharmacists, psychologists, physiotherapists. Those are really the ones that rose to the top as being important for people. We have a whole section about access to medical information. I'm not going to go into a lot of detail here, but just to say that people do think it's important to access their health information online. And 94% of people said it was fairly or very important to have one personal health record that all health professionals working in the province could see and use when they're providing care to people. So that was an overwhelming number of people, proportion of people who felt that way. Then our last section was about reimagining care. And the first question in that section kind of made an analogy to the local public school system. So just as, there are some jurisdictions where just as you can get a guaranteed access to education at your local public school, family medicine or primary care works in the same way. And we asked, do you think teams of family doctors and nurse practitioners in Canada should have to accept as a patient any person who lives in the neighborhood near their office, similarly to a public school kind of model? And here we see 3/4 of people who said, yes, we agree with that, either strongly or some would agree. Anecdotally, I think some of the comments we got back, it's hard to interpret, why did the 25% said no? But I think some of it may be just people thinking, we don't have enough human resources for that. How is that ever going to work? That's some of the feedback I got anecdotally. But interested in hearing your thoughts later. And then we asked a whole bunch of things like, okay, having everybody have a family doctor or NP probably is going to require some trade-offs. What trade-offs would you be willing to make that happen? And people were pretty willing to do things to get to that end goal. In particular, 91% said that they were somewhat or very willing to see the same nurse practitioner consistently for most of their things, except when the NP felt that the doctor is needed. 76%, so 3/4, said they were somewhat or very willing to see any family doctor or NP in the practice, as long as they had access to their records, but they might be a different doctor or a nurse practitioner that they're seeing every time. Interestingly, clearly we have to put that in juxtaposition to the previous, thing we talked about, where what was important to them, where they say what was most important was the relationship. But here you see people saying, okay, I'm willing to trade that off if it helps have everybody have a family doctor or nurse practitioner. And then it was less likely that people were willing to choose just from a list of any family doctor or NP close to their home instead of being able to choose anyone that they want to. So being more limited in terms of who they had to choose. So I think that's sort of the end there. We talked a little bit about the limitations of the survey already. The last thing that I actually don't have slides for, but I'll just mention, is we had a whole kind of experiment section in the survey that explicitly asked people to trade off timeliness with like whether it was someone who knew them, with whether it was something close to home, in a variety of different scenarios. We had 4 scenarios. The sore throat, let's say you have a sexually transmitted infection, or you're feeling depressed and you might feel like you're going to hurt yourself, or you have a chronic medical condition and need to be seen. And it was interesting in all of those scenarios, when I looked at the data, the least important thing to people was actually how nearby the care was for that. The most important in all of the scenarios seemed to be the timeliness. However, the timeliness was more important relative to whether they knew them for things like a sore throat or a sexually transmitted infection. But when then it came to depression, or when it came to specifically actually someone who had a chronic condition, then it started to become very close. So for a chronic condition, basically it was neck and neck whether they wanted to, how important it was to have someone who knew them versus have a timely appointment. And this was for an acute worsening of a chronic condition, so something that got worse. You have like diabetes or high blood pressure, and all of a sudden something's worse and you need to see somebody. So there's something to also keep in mind. Those are kind of more complex results that I haven't presented here today, but happy to talk about.
Excellent. Okay, thank you very much, Doc.